Hello, welcome everyone. We'll just give people maybe 1 minute or two to file in, and then we'll start. Great. So maybe we can get going slowly and people can join. I'm sure they'll join in the next few minutes. Hi, everyone. But we haven't met before. My name is Kerry James, and I'm Chief Exec here at the World Hepatitis Alliance. And I'd like to thank you all for taking the time today to come to this webinar on World Hepatitis Day 2023 and the new campaign that we've all been working very hard for the last 6 months to develop. Thanks for coming. Please do feel free to introduce yourselves in the chat so we have an idea, so people know where people are coming from, but it's great to see so many people here today. Okay, next slide, please. So just a real brief agenda. So we're just going to go through World Hepatitis Day and new things that we have prepared for this year. And then we'll have some question and answer session for people can ask anything or make any comments, and then we can talk about how we can work together this year around different activations and around some press opportunities, and then we'll just finish off with a timeline and some extra Q&A to close. Just a reminder that, next slide please, that we do have translation available into French and Spanish. So if you're not familiar with it by now, just look on the bottom, next slide please, of your window, and you'll see an interpretation button, and just choose the language that you would like to hear through your speakers. So I'll give people just a few seconds to do that if you need to. And so let's get started. So next slide, please. So I think hopefully you'll all remember that 2 years ago when we first launched the Hep Can't Wait campaign for World Hepatitis Day, and it was really talking about hepatitis as something that really needed to act on now. I mean, if you remember 2021, we were still very much in the throes of COVID-19, so there was lots of programs being put on hold and delayed, not to mention just generally the lack of action around hepatitis. And, you know, I think we've all kind of experienced frustrations around the lack of investment or the lack of action, whether that's by global institutions or by local public health or healthcare, that hepatitis just keeps on seems to be being put off. So the Hep Can't Wait campaign wanted to really call for immediate action, that we can't wait any longer for hepatitis elimination. So the first year was really around those kind of key messages, and really using people's names to make the connection between, you know, these kind of broader public health principles that we talk about around testing and treatment, just kind of showing that there's individuals that are being affected by these decisions, not just theoretical policy or public health programs. Next slide, please. So in 2022, we evolved this a little bit more and really brought the voice of those individuals into the campaign. So we really emphasized the I can't wait message. So, you know, people can't wait to get tested. People can't wait to get access treatment. You know, mothers and babies can't wait for vaccination, and, you know, all of us can't wait for a world without hepatitis and a world free of stigma and discrimination. So we were taking the voice from the third person around just talking about people's names and bringing the voice back to the individuals who are really saying this. And of course, we had various assets around there. So for 2023, next slide, please, we're evolving the campaign again. And this year, we're really celebrating action because, you know, people are acting on viral hepatitis. People are making decisions in their own lives that will protect their health, like they're deciding to get tested. They're deciding to start treatment when they're, you know, when their doctor recommends it. They're also protecting their children and their families through prevention of mother-to-child transmission and family testing. So it's really about celebrating action of individuals, but also at the same time, we hope this year is an opportunity for organizations to celebrate the great work that they're doing and the kind of positive attitude they have towards hepatitis elimination. Because all those organizations aren't waiting, they're really making it happen all around the world. And that's really the kind of messaging that we are going to really be stressing this year. So there's basically four main pillars of messaging for the assets that we produced. One around testing and how it could save your life and save you from liver cancer. But we also wanted to have a very specific asset this year looking at liver cancer specifically and making that connection for people. So you'll see in the third slide, one in the blue, it talks directly about not waiting until you develop liver cancer to get tested for hepatitis and how life-saving that could be. And also one around women and babies, about getting tested to protect yourself and your baby. And then one also around families, because when we do the PMTCT work, one thing that comes out really strongly that it's not just, it's not just the mothers and the babies who are affected, but it's the whole family that's affected. And hepatitis elimination really happens within a context of families. So the fourth treatment is really looking at that and kind of celebrating that family element towards the campaign. So those are the A4 posters. Toby shortly is going to talk about all of the assets. But again, next slide, please. Everything will be done in, will be translated versions of the ready-made posters, and there'll also be a translation function on our poster tool, which Tejinder will talk about later as well. So we're really hoping that we're creating assets and things that are be able to use, around the world. And even if your language isn't represented in these ready-made assets, you can translate them into any language you want using the poster tool. So I'm just going to pass on to Toby now, and she's going to talk about the assets. So Toby, maybe just introduce yourself, and then, let's hear about the assets for this year. Thank you.
Sure, thanks, Kari. And my name is Toby Lobakalaoli, and I'm the Communications and Marketing Officer here at World Hepatitis Alliance. So we'll now take you through the 2023 assets. As we do every year, we've created a range of campaign assets which can be used to create raise awareness about World Hepatitis Day. And next slide, please. So the first thing that you can see here is the website, which is now live at www.worldhepatitisday.org, and it has been updated to highlight the 2023 theme and brand. You're very welcome to take a look, get familiar with the website, and definitely also share with your network. And the website is very, very, very user-friendly as well. And at the top, we can see the various tabs that we can navigate based on what you need. The first thing, as you can see on the left-hand side there, is the homepage, which gives you a top-line summary of what WHD is, the theme, and then the 2022 summary report, which also outlines the various activities the global hepatitis community engaged in last year to celebrate World Hepatitis Day. And then the next thing just beside the homepage is the Get Involved tab, which summarizes the different ways to participate in the campaign and the various activations we have planned for this year, which we'll be discussing as we go along in the session. The other tabs on the website to be discussed, that's the pledge, the campaign resources, will definitely be discussed as we go along in the session, but please feel free to take a look at the website and navigate the various tabs as you require. Next slide, please. Okay, the next thing to take note of is the social media assets. So WHD will spearhead a global social media campaign using the hashtags Not Waiting, which emphasizes this year's theme, We Are Not Waiting, and then the ones we're already familiar with, which is the World Hepatitis Day and Hep Can't Wait. So we've created a range of graphics and headlines that you can see on the slide here, which you can find under the campaign resources. in our website that you can share on Twitter, Facebook, Instagram, and LinkedIn. And the good thing about these materials is that they have been made to accommodate the various social media image formats. For instance, as you can see on the left-hand side here, these images that are landscape and rectangular, they are mainly for Twitter or Facebook, or you can use them on LinkedIn as well. And the ones that are square portrait looking here are the ones you can also share on Instagram. You can obviously use the landscape images on Instagram, but it's preferable to use the portrait images so that your followers can see the full image on your feed, even without having to tap on the image itself. You can, like Carrie said, you can definitely download any of these materials in different languages. And if you're feeling very creative or you prefer to use your own copy, there's a creator tool available on the website for you to produce your own materials in the language of your choice. And you can do all this with the filtering tool on the website. Tajina will definitely take you through this in much detail later. And please don't forget to tag us when you're sharing any of our assets on social media at World Hepatitis Alliance on Facebook and Instagram, and at HEP_Alliance on Twitter. I'll share the links on the chat later on. And again, please don't forget to use the hashtags World Hepatitis Day, Hep Can't Wait, and Not Waiting. Next slide, please. All right, the next thing that we have are the Instagram stickers, which you can see on the right-hand side here. So on Instagram stories, if you do not know, there's a sticker button which you can add to make your post more interesting and inviting. So we have designed some really creative animated Instagram stickers, which carry the World Hepatitis Day and Hep Can't Wait campaign brand. And it can be added to your Instagram stories whenever you're sharing and promoting relevant content. So all you need to do on Instagram is for you to just go on your story and search for it under the sticker section, and using any of the keywords like Hepatitis Day, Hep Can't Wait, or you can even just start to type Hep, and any of this icon that you can see on the right is going to show up, and you can add them to your post. And then we also have a series of GIFs that are available to share on your social channels as well, including some of the icons you can see on blue that are counting down to World Hepatitis Day, so that you can have the 1 month, 7 days to 5 days to 3 days to, or whatever you want, just to raise awareness and stir conversations around World Hepatitis Day. Next slide, please. And then we also have posters that are under the same brand of the We Are Not Waiting brand. And these posters are in A4 size and are available to download from the website in 6 different languages. And the posters you see on blue by the side here are the ones we used from last year, which are still very much available for you to download as you require. They mostly highlight the testing and treatment messaging. So in case you're thinking of any ways to use these posters, you can download and print them to use and display at your community centers, your places of worship, your workplaces, or any place of interest, just to raise awareness about World Hepatitis Day. Also, just as a note, I just wanted to note that there'll be more versions of the asset that will be uploaded on the website shortly. So you can have different image options for you to use for the posters and the social assets. So I'll just leave Tajinda now to take you through the poster tool.
Great. Hi, everyone. I'm Tajinda. I'm the Communications and Marketing Manager here at World Hepatitis Alliance. So just to follow on from the assets that Toby went through, we have a customizable tool, and this can be used on the posters and all of the social media assets as well. So you can create your own custom posters and social media assets, and there are all the languages available online to translate the posters and the assets. You can edit the text. So you can see a little screenshot there of the messaging that you can choose. For example, there you can see the liver cancer testing message has been chosen, but there's other testing, other messaging in there as well for you to choose from in terms of what you can't wait for and what you'd like to take action on. You can add your logos and choose your own images as well that are right for your community as well. So feel free to go in and play around. And as always, get in touch if you have any questions about any of it. We'll also have a new video being launched in the next week or so, which we're really excited about. We wanted to just share some teaser screenshots with you of what will be coming up in the video. And you'll see this across our channels once it's live. The campaign video is part of the We're Not Waiting campaign and theme, and it emphasizes that every 30 seconds, someone loses their life to hepatitis. We're not waiting for change, we're making it happen. So keep your eyes peeled for the new video, and please use and share this as much as you'd like to. It will be up on the website as well. So just to kind of summarize all of that, all the assets that Toby and I have gone through will be in the campaign guidelines, which are now live and on the website. So this is just a bit of a snapshot of what's included. You will find lots of information in there about the messaging, the theme, the call to action. It'll be great if everyone can kind of take a look through this to familiarize themselves with whatever they're doing for World Hepatitis Day this year. Obviously, the theme is around we're not waiting to take action. So there's lots of messaging in there throughout. There's some facts and stats in the campaign guidelines as well, a bit about what we want to achieve collectively and globally for hepatitis elimination on World Hepatitis Day as well. And then there's details in the campaign guidelines around the branding, so logos, colours and fonts. There's all the resources available, so the assets that Toby has shown you, the films, the Zoom backgrounds that we're using now, and PowerPoint templates as well. There's also a lot of detail in there about the campaign activations and ways to get involved with World Hepatitis Day, which we'll be chatting through in the next section of the webinar as well. So we encourage you to go onto the website, take a look and download and use this as you'd like. So now we'll just pause for a Q&A. If anyone has any questions or thoughts on the assets that they would like to share with us. So I can see a couple of questions and comments in the chat. So thank you so much for the thoughts on the assets. So the assets can all be found under campaign resources in on the World Hepatitis Day website. The customizable tool is a really great tool as well for the posters and social media assets. So feel free to play around, and as mentioned, let us know of any questions when using that as well.
Mahmoud has his hand raised. Don't know if we can unmute his mic.
Great. As I'm sharing, Carrie, would you be able to do that?
I can't because I'm not a co-host. Maybe Ben, can you help, please? Just looking in the chat. Yeah, the color codes are in the campaign guidelines, Diana. So you can just look in there, but if you can't find them for any reason, just let us know. But all the color codes, the fonts, everything's in the campaign guidelines on the website. You can definitely make similar videos. I mean, you'll see the way that the video is made comes out. Tajinder is going to talk a little bit about our global video relay later on, where communities make their own videos and then we post them all at different time zones around the world. When it strikes midnight in your time zone, we post them. So I think that's a great idea. And I think We're Not Waiting is a great little video clip of your service users or your volunteers or whatever all shouting "We're not waiting" and posting on World Hepatitis Day. I think that would make really great content.
Mahmoud, I've unmuted you now if you'd like to ask a question. Mahmood, do you have a question?
Maybe not. Maybe go to Patricia. And then Mahmood does, he come back.
Great. Patricia, if you just want to unmute yourself, you can ask your question.
No, I don't want to make a question. I am reading about other questions. For example, if anybody can focus on specific topics like hepatitis B, bird dose, yes, they can. Every topic, cancer or any other, no? Because we can't wait to do anything that we can do for hepatitis elimination. Thanks.
Exactly. Yeah, the campaign is meant to be like a framework for all of you to put in the messages that are most important in your own areas, in your own countries, in your own local areas. So the real purpose of the campaign is to provide that framework, and that we're not waiting, HEP can't wait, can then be used in whatever makes the most sense for you locally. Tina, I just see a question about larger versions of the posters. If you email us afterwards, we can see about getting artwork for you in larger sizes. We're happy to do that. The PDFs on the website will be A4 size, but if you want larger, or if you want them for outdoor use or anything, yeah, we're really happy to work with anyone to customize any of the assets for you guys to print or use in any way that you want. Patrick, do you want to unmute yourself and ask your question or comment?
Yeah, I'm just asking, is it okay to put our organization logo on the poster?
Yes, absolutely. Feel free to use the assets in
Okay.
any way that you want. They're completely open source.
Okay, thank you, Kari.
You're welcome. We just answered that one. There's a question from Maria, but it's in Spanish. I don't know if one of the interpreters could help.
So I can see a question about the color codes. That's all in the campaign guidelines, which is live on the website to download.
The question from Maria is that the video will have titles or captions. This is the question from Maria.
Right. So we can either we can either provide a version where you can put in your own subtitles, or if someone can help translate the script, we can have the subtitles placed onto the video. So again, just reach out to the comms team and we can try to make all those things happen. But we just might need a little bit of help just doing the Spanish translation.
Okay, I will do the Spanish translation. Send me the text, and I will do that. Yeah. Okay.
Oh, brilliant! Thank you, Patricia. So all of the posters are on the website to download. So just visit worldhepatitisday.org, and you can download all the posters. There are going to be more versions uploaded later today with more picture options for the ready-made ones. So if you look today, do check back tomorrow or early next week, and there'll be more images of more ages and more ethnicities and all those things. And Ingo, yeah, just let us know. This isn't my specialist area, but we have in the past provided versions of the video where people can simply add their own subtitles. So yeah, let's circle back on that.
Another
No, guys, were
question
there any
in
other
Spanish. In Spanish, another question from Maria is
Mhm.
that the messages are directed to people, not to health teams. Health teams. For the health teams to ask for the test. Yeah. So she asked why we didn't make that didn't that message to the health team. Okay.
Mhm.
So everybody can customize the message. Yeah. Please,
Yes.
Carrie, can you expand this? Thank you.
Sure. So, I mean, generally the World Hepatitis Day assets we use for for general public awareness, because it's the one time in the year that we really create stuff to support people in their own testing campaigns, their own activities. But obviously, it's a very good point. Like, we need to make these points to decision makers as well. And if you go into the poster tool, you can customize the messages. So you can write your own message directed towards public health officials, and then just output the PDF and then use those locally. So that's why we really created the poster tool, so people can really make the posters that they need the most for their situation. Thank you.
Great. Shall we move on? And then we have more time for questions later as well.
Sure. I think I think Leanne just asked about the video itself. The audio language will only be in English, but as I said, we're very happy to help people with creating the subtitles in other languages. But yeah, let's move on. If there's any questions in the chat that we didn't have, maybe we'll try to catch them in the second Q&A.
Okay, cool. Thank you so much. Now we're just going to quickly chat about how we can work with you all and collaborate on some activation. So in the next few slides, we'll be showing you some examples on how we can work together. Next slide, please. Thank you. So the first thing here is the 1 minute actions. So this represents quick actions that you can engage in within a minute. Most of these things are things you probably do on a daily basis, such as sharing some of the social media assets, which I shared with you earlier, across social media platforms. So you can share these graphics with your network to join the campaign on WhatsApp, Instagram, Facebook, Twitter, or LinkedIn. And you can also share short 30-second videos where you can talk about what you're doing to mark World Hepatitis Day, or what hepatitis means to you on Facebook and Instagram reels, like you can see with the lady here. Or you can also share on your stories and use any of our stickers that are available on Instagram as well. But whichever way you choose to share on social media, either on WhatsApp, Instagram, Facebook, or Twitter, please don't forget to use our hashtag, as I've said earlier, not waiting, Hep can't wait, or World Hepatitis Day, and tag us in all of your posts. It's important for us to emphasize this because it's a very good way for us to track all the interesting things you're doing in the campaign, and also for us to build the online conversation around World Hepatitis Day. And we can also repost all of your posts across our social media channels as well. Another action you can do in a minute is the pledge. As you can see, the white icon here, there's a pledge section on the website which has been updated, where you can pledge your support for World Hepatitis Day. I believe everyone here supports the cause, and that's why you're here. So please feel free to sign the pledge and spread the word to your network to do the same. So Tajinda can take you through the longer actions. Next slide.
Great. So yes, then we have longer actions as well that everyone can take part in. So as mentioned, we've gone through the posters and the customizable tool in a lot of detail. So please do use these, print these out, put them around your local communities, centres and workplaces and places of worship. Engage your medical professionals, your local pharmacists, to display these in their clinics and pharmacies as well. You can plan an event. So it's worth thinking about what type of event you want to plan, where you want to hold it and when, what budget you have. There's a huge section on the website with details around planning an event, and it includes details on planning, holding, things to do during and after your event, and an event checklist as well, so we can send this around. As part of events, you can host a webinar just like this one. It's a great way to gather an audience online. You can get a huge number of people together. You could just decide on your topic, could be anything, and choose your speakers as well. Don't forget to use our Zoom backgrounds that we're using now if you are hosting a webinar. You can arrange advertising across billboards, buses, and other displays. This might be paid, but it can also be free. And it's worth looking into because some companies will donate some space for your World Hepatitis Day campaign. And this is where a great chance to use the World Hepatitis Day posters and other assets as well. Another fun kind of activation and initiative is lighting up local monuments. So this is a great way to grab people's attention. It's great for PR as well, and you can contact relevant organisations to make this request. So in the past, some structures that we've seen lit up for other awareness days are the Houses of Parliament in the UK, the Sydney Opera House in Australia, the Niagara Falls in Canada, Crystal Hall in Azerbaijan, Osaka Castle in Japan, and many, many others as well. It's really great and important to engage your policymakers and influencers. So really anyone can lobby for what they believe in. And as Toby said, we all believe in this cause and we all want to eliminate hepatitis. So when you're engaging your local policymakers, you can initiate meetings, write letters, make phone calls, and there's lots of other ways as well. We have template letters on the World Hepatitis Day website that you can use to engage your policymakers. And it's important when you're kind of doing all your activations for World Hepatitis Day to not underestimate the power of human stories and perspectives as well. I think people who share their story are really brave, and there's lots of people who share their stories who are living with viral hepatitis, as we know, and these can help to educate others. This can help to raise awareness, provide support and inspiration for others as well, tackle stigma and discrimination, and just really highlight the true impact of this global disease. So all of this website, all of this information of longer actions, 1 minute actions is available on the website. There's lots of detail around how to do everything. So definitely go on there and take a look. So we're really excited for our virtual global relay this year. So we'd love for all of you to take part and join in, whether you're members, advocates, civil society, partners or stakeholders or anyone else. All it requires is a 30-second video explaining what the elimination of viral hepatitis means to you. But we'd love for you to kind of draw on the theme this year of we're not waiting and what you're not waiting for in terms of viral hepatitis elimination. You can see some snapshots of who we had take part last year. We had over 70 organisations and individuals join the relay last year across 26 countries. The way it works is that we collate your videos and we launch each of these videos at midnight in your time zone on the 28th of July, creating a really huge virtual inspiring global relay. So we encourage you to take part, whether it's, you know, an individual message, a group message with your organization, and again, to just tell us how you're not waiting for hepatitis elimination, the action you're taking, what you're doing to celebrate the day, and how you're joining the call to action as well. Again, lots of details will be going out on our channels to join the Global Virtual Relay. So keep an eye out for that, and you can get in touch with us as well for any questions. But there's lots of information on the website, and we'll be sharing lots of information about how to get involved as well. So as previous years, this year we'll be hosting 2 webinars. The first will be our annual community forum. It was really, really well attended and really inspiring last year. It was chaired by our president, Danjuma Ada from Nigeria. And in this forum, we hear the stories and perspectives of people living with viral hepatitis. Some of the topics they discussed last year were stigma and discrimination, the role of advocacy, prevention of mother-to-child transmission, support for mental health, and other needs and support for people and communities living with hepatitis. The second will be a focus on integration with universal healthcare. It will be a panel and audience Q&A, and there'll also be a big discussion around closer working with the liver cancer community and NCD community as well. So keep an eye out on our channels and via emails as well for updates on the dates and timings and how to register for these webinars. So we just want to chat about press and media amplification. So as many of you know, media is one of the most influential advocacy partners that we have, not only to raise awareness of hepatitis, but also to raise awareness of World Hepatitis Day. Media has a lot of power to exert influence on policymakers and other decision makers as well. So we really want to amplify this part of it with all of you as a collaboration. Last year, our press outreach with members' help as well landed over 750 media articles globally. So we'd love to achieve the same. And this year we want to raise awareness further and push our messages further through press. Last year we had many who used our press statement and translated this for their local national media. So it'd be great to coordinate in this way again. Also, journalists and media are always interested in something new and new content. So this year we'll be issuing a global survey to highlight the lack of awareness that hepatitis is the largest cause of liver cancer. So we'll be using this data as part of our press strategy, but we'll be sharing the results of the survey as well. So it'll be great to kind of collaborate and coordinate on how the data is used and how we can amplify this in media and the press as well. We also use media to share personal stories, as I mentioned before, and the power of storytelling. So, you know, those with lived experience who come forward and share their story, it's really powerful and engaging and raises awareness as well. And we had BBC News cover our board member Leanne's story last year, which was really great. And it gives that real life perspective, which is so important, and again raises awareness for viral hepatitis. There's a lot of information again on the website about media, working with media tips and tactics and how to write a press release. So definitely check that out, but also please do get in touch with us to coordinate amplification and various statements as well. So just moving on, we just wanted to highlight kind of the support and involvement of leaders and influencers in World Hepatitis Day too, again, to raise awareness and more importantly, save lives. So there's a number of ways and activations to get involved, which we've just gone through in this presentation, but also they'll be in the campaign guidelines, like the virtual global relay. And to amplify the message further globally, we'd love the involvement of leaders and influencers to share the message and raise awareness in various ways. So this could be a social post, this could be the virtual relay, this could be a video statement, it could be a written statement, it could be a press quote, it could be anything. So let's definitely coordinate and please get in touch for different ways to do this. We also want to get hashtag World Hepatitis Day trending, which it always is on the day, with lots of impressions as well. So as part of all of this, we'll be sharing a communications toolkit widely, which will include all of the assets. It will include the messaging. It will include template social posts, videos, hashtags, and a summary of the activations as well. So this communications toolkit alongside the campaign guidelines should be everything you need, and give a variety of ways to get involved, which is really exciting. And we'll have this toolkit ready for you towards the end of June, around the week commencing 26th of June. But if you'd like to receive this by email, definitely let us know. So I guess last thing is just to count down to World Hepatitis Day. So we've obviously launched and kicked off this webinar today to invite you all to engage with everything that's on the website and all the assets and all the activations. As always, do get in touch on our contact email, which we can share on the chat. We'll be at EASL in Vienna from the 21st to 24th of June. So come and find our booth and our hub. We'll be in the patient synergy zone, and we'll be chatting about World Hepatitis Day and various other things as well. And then these are just a few other timings to keep in your diary. So we're looking to hold the community forum the week commencing around the 20th of July. We'll have a deadline for the global virtual relay videos and other content that week commencing 24th of July. So please do get everything to us sooner rather than later if you can. And it's really helpful for us to bring everything together. And then just before World Hepatitis Day, we'll be holding the UHC, the Universal Healthcare and Liver Cancer webinar. And then 28th of July is World Hepatitis Day itself. So not long to go, which is very exciting. So we could just pause there for more discussion and Q&A. So I've just asked you to unmute yourself, Oluwaseun Ulafemi. I think you had your hand raised.
Okay, good afternoon, Nigeria time. Hello.
Hi. Yes, we can hear you.
Okay, I'm Olufemi Oluwaseun from Center for Family Health Initiatives in Nigeria. So I want to say thank you for this webinar, for the posters, everything. In fact, they are giving us quite a lot of materials that will be very useful. So far, we already have a roadwork plan in the organization. We are looking at having a roadwork to create awareness for what hepatitis is. And we've actually written out letters for sponsorship because we're going to have a media coverage and we're going to be going into the market. We are partnering with some community-based organizations in Nigeria. So I don't know if there's a way you can also support us aside from, because we also need to print out these materials and also because for now we have our budget and what we are looking for is funding for the activity. We already have the plan figured out and we reach out to some organizations for sponsorship. So I don't know if you can also sponsor us. If there's another means you can sponsor us to make the day more colorful. Thank you.
Thank you. Thank you for that. So I understand you'll be doing media activity and printing various materials and assets, and you're asking about sponsorship. Carrie, do you have anything to comment on that?
In terms of sponsorship, I'm afraid we're not very useful for that for locally. I mean, we have many members in Nigeria, so I don't know if it's worth speaking to other members in Nigeria to see if there's some requests that you guys can do together. But unfortunately, we don't have much support around sponsorship. We realize the really, challenging situation funding is for everyone working in hepatitis, and we wish we could be more helpful, but I don't really have any local funding advice at the moment, I'm afraid. There were a couple of questions just in the chat I went through. One was around translating into local languages. And if you go to the poster tool, you can translate it into any language that you like, and then output it as a PDF and choose your own pictures and do anything like that. One was around the sizes of the posters, if you could have larger formats. Yeah, just email contact@worldhepatitisalliance.org and we can decide which posters you would like with the larger format, and then we can provide those for you. And then if we produce them, then I actually will probably put them up on the website anyway, so other people can use them as well. There's a question about engagement with young people, and we really do try to engage young people as much as we can in the campaigns. We actually launched a really great video, maybe someone could put it in the chat, of a young person from Michigan, part of a new series called I Can't Wait, which is a new video series we're doing. But yeah, I mean, please do it. I think it's important that young people get involved in these campaigns. It's been a kind of a priority for us for a while, and we're still having kind of discussions with different organizations around the world about how we can meaningfully help create a youth movement in viral hepatitis. So if you're interested in that and have some tips, please do email us. We can be part of that conversation. And again, with the poster tool, if you want to create more posters for tailored towards young people, you can use your own photos in the poster tool. So you can put your own pictures of community leaders or young people in your area and create assets for you to share from your organization. And there's just one question about the slides. Yeah, we'll be happy to share the slides when we follow up after this webinar, with an email after the webinar. Any new questions in the chat, guys?
No, but just lots of great comments. So Naya Akbar shared a great comment about the work of hepatitis B and C screening in remote parts of Punjab and Pakistan. So they will be going through the website thoroughly to kind of carry on with their mission, which is great. Toby has shared the video. It's the story of David Urich. He's one of our advocates for hepatitis B, and he spoke at our young people's session at the World Hepatitis Summit last year. So definitely check out his video.
Any other questions? I guess we could also just remind everyone that there is that the World Hepatitis Summit is coming back next year, 2024, in April in Lisbon. So I'll just put the URL in the chat. Do check it out and register your interest. And then registration should be opening in the next month or so. And we really look forward to seeing you all in Lisbon. And we will have a scholarship program for members again. So do keep an eye out for that as well.
There's just a question about adding organization logo to assets, which you can do with the customizable tool. There's a question about our work in Pakistan. So we definitely have members in Pakistan. So please go to the World Hepatitis Alliance website and check out our members section. And there's a drop-down list for all our members there. Prince Okinedu, thank you for your message that you'll be organising a viral hepatitis summit targeting government, healthcare providers and general public, and you'd like to have a discussion about this. Be great if you can share your email and then we can get in touch.
Just want to talk about that comms toolkit a bit more. There's a few questions about messaging and some messaging around cancer at NCDs.
Sure.
So we'll be, yeah, go on.
Yeah, the comms toolkit it will be similar to the campaign guideline, but it will contain long copy and short copy that you can use across your websites, you can use across your newsletters, and you can also use this as part of statements that we'd really love leaders and influencers to get involved in, whether that's written statements or video statements. And we'll also have template copy for social media posts. So what we'll do is we will use the messaging from the World Hepatitis Day campaign and theme itself. But if there's anything specific and that people would like help with messaging, then we can definitely add that in as well. So yeah, text messages about cancer and NCD involvement. We will definitely have a lot of messaging about cancer, and there'll be a lot more discussion around this in terms of the webinar that we'll have with discussing cancer in the NCD community as well. We'll share a concept note for this as soon as we can, perhaps in the next 2 weeks or so that you can start to use this locally as well.
Patricia, you can unmute yourself.
Thank you very much. Is there another question from Ingo Fontil? The question is there any simple way for participants to edit videos without subtitles, for example, German? Are there more options now, for example, with intelligence artificial-based tools or alliance tools? This is the question, 2 questions.
That's a very good question. We can ask the agency that created the videos for us around AI translation. I mean, I know we did use it when we were doing the mock-ups for to create the video, and then we're going to have real people do the actual voiceovers. But if that would be useful, we can definitely ask them about it. Obviously, the quality is not going to be quite the same because it's going to have voices from people from different parts of the world, which I think might be difficult with AI, but they can do so many things now. Maybe you can. So we'll definitely ask and follow up on that. But we can also provide a version of the video without any voiceover if people want to put their own voiceover on it. We've already talked about subtitles. So we're really you know, up for collaborating as much as possible if you just reach out to us.
Okay. And other is okay. There are many questions about the translation, and the translation is okay for every language you want to translate, because the poster it can be custom editable, and can put the logo, organizations, and many other changes. Yeah.
Yeah, you can do all of that on the poster tool. You can change the language, you can put on your logo, you can do all of those things.
Thanks, Carrie.
No problem.
Thanks.
Okay, well, I mean, if you have any other questions or you want any support with anything, just let us know. If you have specific requests around the video, do send an email to contact@worldhepatitisalliance.org, just so we have that noted. I mean, we're taking notes of everything in the meeting, but we're still going to do that. Actually, Leanne, you have your hand up.
Yeah, thanks, Carrie. I hope that you can hear me. I guess my question is around the video series that you mentioned earlier. So I know now that we have the video with David already available. Can I ask if there are any others lining up from now until the 20th of July?
So there's for the I Can't Wait series, that's just that's going to be running independently of World Hepatitis Day. So there will be more I Can't Wait videos. There'll be a whole series. So there'll also be this year one from Shaibu from Tanzania, who some of you may know from Twitter and social media. And we're also going to do one from a woman from the UK. And then we're hoping to do another one with someone from Asia all before the end of the year. And that series will be continuing into 2024 as well. This year, we're going to have another produced video similar to the ones we did the previous 2 years using the I'm Not Waiting theme, which we expect to have ready in the next week to 10 days.
Thank you, Carrie. That'll be great. We are running an event around Hepatitis Day, and thought that'd be great to have those videos to play during the event. So that's why I asked.
Yeah.
Thank you.
I mean, you're very welcome to use the David video as well, of course, which is really a really cool video, I think. Ingo?
It is.
Actually, my question was already answered, so I don't need to speak.
Okay,
Thank you.
nice to hear you anyway.
Yes, same here.
Okay, any other final questions anywhere? I mean, yeah, I see the questions about funding. I'm really sorry, but we just don't really have any leads for local funding. But yeah, we would definitely help if we could, but we just don't have any. We just don't have any at the moment. Okay, well, that kind of takes us to just about an hour. So maybe we can wrap up. As I said, please do reach out if you have any other questions or comments. And I just want to thank Tajinder and Toby for doing such a great job presenting, and for all of you for attending today. And we look forward to continuing to work together over the next 6 weeks to make this World Hepatitis Day the biggest event ever. So thank you so much, and see you all again soon.
Thank you. Bye.
Thank you, everyone.
Thank you.
Bye.